Dr. Balaga here. I have another terrific God Knowledge Doc podcast for physicians and advanced practice providers, including physician assistants and nurse practitioners. You should find this podcast very useful in your practice. Today I'm discussing the paper Coronary CT Angiography Guided Management of Patients with Stable Chest Pain, 10-year outcomes from the SCOT-Heart randomized controlled trial in Scotland. I'm recording today on the 30th of January 2025. This is hot off the press. The lead author is Professor Michelle Williams, and the last author is Professor David Newby, both from the University of Edinburgh. The Scottish Computed Tomography of the Heart, SCOT-Heart trial, demonstrated that management guided by coronary CT angiography improved diagnosis, management, and outcome of patients with stable chest pain. In this study, the authors report whether CT angiography guided care results in sustained long-term improvements in management and outcomes. There was an accompanying commentary on this paper by Professor Todd Willens from the University of Virginia. Why has coronary angiography changed clinical guidelines? For decades, the standard approach to evaluate stable chest pain relied heavily on stress testing, including exercise ECGs and nucleus tests. But recent guidelines have shifted towards coronary angiography, CT-guided coronary angiography, as the preferred first-line test for patients with known coronary artery disease. This shift is largely due to landmark studies like the SCOT-Heart, which demonstrated that coronary CT angiography significantly improved diagnostic certainty regarding coronary artery disease. Here's what we learned from the 5-year SCOT-Heart analysis. Coronary CT angiography significantly improved diagnostic certainty of CAD. It led to increased prescribing of preventive therapies like statins, aspirin, and antihypertensive agents. Most importantly, it reduced the risk of non-fatal myocardial infarction and coronary heart disease death. But the question was whether this benefit was long-lasting or did it fade over time. That's where this study reporting the 10-year follow-up comes in. In this latest Lancet report, we now have a 10-year follow-up data to assess the long-term impact of coronary CT angiography on stable chest pain management. Here's what the 10-year analysis found. A continued reduction in coronary heart disease death or non-fatal MI, 6.6% in the coronary CT angiography group versus 8.2% in the standard care group, p-value of 0.04. Major reduction in non-fatal MI, p-value of 0.017. The second important takeaway was preventive medication use remained higher in the coronary CT angiography group, 55.9% versus 49% with a p-value of 0.034. This suggests that coronary CT angiography helped to sustain long-term cardiovascular prevention strategies. Another advantage was there was no increase in unnecessary coronary interventions. Coronary revascularization rates were similar between the standard group and the CT angiography group. This confirmed that coronary CT angiography does not lead to excessive or unnecessary procedures. So what does this mean? The benefits of coronary CT angiography extends well beyond the initial diagnosis. Patients continue to experience lower heart attack rates for at least 10 years. what do these findings mean for patient care? The durability of benefit from coronary CT angiography is a key finding because it confirms that early imaging leads to lasting changes in clinical outcomes. Why does coronary CT angiography lead to long-term benefit? Unlike stress testing, coronary CT angiography directly visualizes coronary atherosclerosis. This allows earlier initiation of aggressive preventive therapies. These early interventions translate into fewer heart attacks over time. Does this change how we manage stable chest pain? These findings reinforce guideline recommendations that coronary CT angiography should be the first line for stable chest pain. It also suggests that coronary CT angiography could help identify high-risk patients for intensive prevention. What about concerns over long-term data? The main limitation of this study is that it did not collect detailed medication adherence data. It also did not track the total burden of cardiovascular events such as recurrent MIs. However, despite these gaps, long-term reduction in myocardial infarction remains strong evidence of coronary CT angiography's benefits. Coronary CT angiography should be considered as first-line test for stable chest pain, particularly beneficial for intermediate risk patients. Women may derive greater benefit, the so-called diagnostic gap reduction. Coronary CT angiography leads to better medical management rather than more interventions. The future of coronary CT angiography in cardiovascular prevention. As imaging technology advances, coronary CT angiography is evolving beyond just a diagnostic tool. What's next for coronary CT angiography? First, plaque-guided prevention instead of just identifying stenosis. Future coronary CT angiography strategies may focus on personalized risk reduction based on plaque characteristics like inflammation, which may allow early initiation of colchicine. Who knows? Second, artificial intelligence in coronary CT angiography can help automate risk assessment and guide individualized therapeutic plans. Thirdly, expanding clinical applications. Should coronary CT angiography be used to predict cardiovascular events even earlier in asymptomatic patients without chest pain, particularly in high-risk ethnicities like Desis or people from the Indian subcontinent? Studies which are now exploring plaque morphology and composition may impact long-term risk. What is the bottom line of the study? The SCOT-Heart 10-year data confirms coronary CT angiography is not just a diagnostic tool. It actively changes patient outcomes for the better. As research continues, plaque-based prevention strategies may revolutionize how we manage cardiovascular risk. Final thoughts and call to action. So what's the take-home message? Coronary CT angiography remains the gold standard for stable chest pain evaluation. Its benefits last well beyond the initial scan, reducing heart risk for at least 10 years. The future of coronary CT angiography lies in precision medicine, targeting therapy based on plaque burden, and it may even predict plaque inflammation. What do you think? Should coronary CT angiography may be mandatory for all stable chest pain evaluations? Should it be done in all high-risk populations, especially in people with elevated LDLs? Should coronary CT angiography be done every 5 years, for example? So-called the cholesterol years hypothesis. The longer you're exposed to cholesterol, elevated cholesterol, the higher the plaque burden. So exciting data to be collected and may change risk assessment of patients with coronary artery disease. In lower and middle income countries, this may be expensive. In such individuals, maybe LDL cholesterol, elevated LDL cholesterol may be the way forward, but looking at an image is more likely to get the patient to adhere to therapy, because patients don't like to take, or individuals don't like to take medications. And so visualizing the plaque may prompt them to adhere to preventative therapies with statin